Okay, good afternoon everyone. I'm Jason Pembroke, the Bioanalytical Group Leader here at Domainex, and I'm just going to give you a whistle-stop tour of our mass spectrometry-based covalent screening platform. So a quick background to covalent inhibitors for those of you not familiar. These are not dissimilar to your typical small molecule inhibitor in that primarily what we're trying to do is dose this into a patient. The compound goes and interacts with a binding pocket within a target protein and alters or removes the biological activity of that protein. The main difference with covalent inhibitors is that they contain a reactive warhead that is able to form a covalent bond with an amino acid residue within your binding pocket of your target protein. This brings with it, well, it essentially docks your compound into that binding pocket sort of permanently or semi-permanently, I'll say. I'm reluctant to say permanently, which I will come on to explain. This has obvious benefits around potency, duration of action, which then brings with it a requirement for lower dosing frequency, which tends to give you improved patient compliance when it comes to dosing. Covalent inhibitors have actually been around since the late 19th century. They were initially marketed in the form of salicylic acid, or as more commonly known as aspirin, which so I dare say some of us have been ingesting some covalent inhibitors perhaps mornings if we've woken up with a slightly sore head on occasion. The mechanism of action wasn't actually understood until the early 21st century, and this brought with it some concerns around the safety, because ultimately what you're doing is permanently removing the biological function of a protein. So if you're getting some off-target toxicity effects, it could be understandable that those effects could be quite severe because you're permanently removing that protein from an organism. So, the mechanism of action, there we go. Like I mentioned, very similar to a typical small molecule therapeutic. We have the affinity, the interaction with the binding pocket of your target protein, and that's something that we can look to tune by improving that affinity and looking to improve those K-on versus K-off rates. The main difference being that once that reactive warhead is sat within a close proximity of the thiol group or the group within your amino acid residue, if they sit there long enough and close enough to each other, that covalent bond formation will occur, and that will lock in your inhibitor permanently. So this is what we call irreversible inhibition. There are compounds that act as reversible inhibitors, which I will come on to explain, but are challenging from a bioanalytical perspective, but do bring with them some benefits around safety and toxicity. So your initial mechanism is the same. You're looking at playing with your affinity for a binding pocket. But then when it comes to your actual covalent bond formation, that covalent bond, as well as forming, it can also be broken and cause your compound to drop off. So like I say, they don't always conform to your typical analysis workflows, so they've made it quite tricky for us on occasion, but we've come up with some solutions to analyse those. And then because you're not permanently removing that biological function of the protein, your tox effects are going to be less severe, at least in theory. A quick intro to our internal covalent fragment library here at Domainex. So we've got over 700 compounds within that library, a diverse range of warhead classes and molecular properties. So the information for these was typically taken from covalent inhibitors on the market, covalent inhibitors that are in the clinic, and also by reading around in literature to see ideas that are gaining traction in the literature. So, covalent screening, what is it? What am I up here banging on about? Ultimately, what we're looking to do is take a library, so either a client source library or a commercially purchased library, and screen it against our target protein. We're then looking to identify which fragments bind to our target protein before we can then take those into design, make, test cycles with our synthetic and medicinal chemistry teams. We have the capacity to pool compounds, so we have the liquid handling and the software to pool compounds if we're working on particularly big libraries, or we can just run single-cut analysis where we have one compound in each well. The compounds get incubated with protein, and then we run high-resolution mass spectrometry to identify which fragments bind and which ones don't. The incubation process is actually quite important at this stage. So we would optimize that as part of the method development for the project. We can look at incubation times, incubation temperatures, and probably most importantly is molar ratios of compound to protein. So this is important. Obviously, you want to be putting in enough compound to identify some hits, to get some binding occurring. The whole point of hit identification is to identify some hits. But you don't want to go so far the other way that you're introducing and so much compound that you're saturating the system and artificially introducing some binding events. So we try and identify that Goldilocks zone, and we tend to go a little bit above that because I think it's sensible here. You'd rather have a few false positives than miss out on some false negatives. I think there's the scientifically validated law that is Sod's law, which guarantees that the hit you miss at this stage would have gone on to be your blockbuster compound in the clinic. So we run some rapid LC on the front end of our mass specs. We're running sub 1 minute analysis times, and the mass spec, the QTOF system, gives us a raw spectra that looks something like this. Not particularly user-friendly or informative at this stage unless you have a sort of very well-trained eye. So our software deconvolutes these spectra and gives us single mass peaks for each component within our sample. So what we've got here is a well-known covalently inhibited protein in KRAS. So this is the G12C mutant, which is involved in oncology. So you'll see on the left-hand side, this is a sample that's a negative control. So that contained just KRAS protein on its own, no compounds within the sample. And you can see a deconvoluted mass peak at the expected mass of your KRAS protein. On the right-hand side, this is a sample where the known or the commercially available sotorasib covalent inhibitor was incubated with the KRAS. And you can see from the blue arrow, that's where your naked, your unlabeled protein should appear, and you see complete disappearance of that. And then you see the appearance at an abundant peak of your KRAS plus sotorasib at the expected mass, given the mass addition of sotorasib. So when we run our screen, we're effectively generating thousands of these deconvoluted spectra, which would take some time and be quite mind-numbing to go through and interpret. So for the analysis, we've developed some automated data processing. It's based on a Python script, and it takes those deconvoluted spectra. We tell the software our mass of our protein as well as the mass of our compounds and which compounds were in each particular well. And this then gives us the software does what it does, spits out a binding percentage for each compound as well as the stoichiometric ratio. So the stoichiometric ratio is flagging to us that we're actually seeing multiple binding events for one compound on a protein. And this is something where we are able to dive in and pull apart, and I will discuss that on my next couple of slides. But I just wanted to add as well, we run a secondary data analysis pipeline here where we look at plotting observed mass changes for binders versus expected mass changes for the binders. And ultimately what this does is it's highlighting when you're identifying a binding event in a sample, but that binding mass doesn't add up to what you've told the software that it should be. And this is caused when you have a leaving group within your molecule. So as part of that covalent bond formation, a group within that molecule will fall off. And because we're looking at a mass spec readout, the software can't compute that. So ultimately it's saying, look, I'm seeing some binding, it's not what I'm expecting, go and have a look at it. So I say it's fully automated, there is some user input there as a sanity check. So we'll go in, we'll have a look at that and see what's going on. Typically we can run this past the chemist and they can go, yep, that makes sense, that group would leave in that compound. So I touched on our binding site identification. So when we see multiple binding events, we can go in and run our peptide mapping workflow for our protein. So what we're doing here is we take our protein that has covalent binder attached, we digest it into peptides with a proteolytic enzyme, which the gold standard is trypsin. We don't have to use trypsin, we can optimize and develop methods with other enzymes if needed, if trypsin gives us poor data for whatever reason. And ultimately, what we're doing here is we're running data-independent acquisition. So I won't go into the specifics of this overly, but we're acquiring information about the intact mass of all of the peptides, and then we're fragmenting those peptides simultaneously and getting the information about the fragments. So it's a bit like piecing back together a puzzle. So the software can piece back and tell you the sequence of each peptide. We then feed in information about the mass of our binders, and it factors that in and can then tell us which peptide within the protein the covalent compound has bound to, and normally which amino acid. It's, normally that's self-explanatory. Let's say if you have a cysteine in a particular protein, but we can do that as well. So yeah, this is particularly useful in examples where you're seeing multiple binding events. Interestingly, a project we worked on, the client was targeting cysteine residues. We had a protein with one cysteine residue, and we were getting hits which were actually showing multiple binding events. So that was quite interesting to dive in and identify where else in the protein the compounds were binding. But it's also nice to just validate any computational data that you have to confirm that you are actually hitting the site that you think you are. So we'll also run a reactivity assessment for all of our hits from the initial screen. We use a GSH assay to do this. So GSH, or glutathione, is an antioxidant that is the most abundant antioxidant within the human body. It's present in pretty much every cell. It's a tripeptide that contains a cysteine with a readily available thiol group. So it makes it the perfect assessment for this sort of analysis. It's both chemically and biologically relevant. What we're doing here is we're incubating our compound with the GSH, and then over time, your compound interacts and binds to the GSH. We can then plot the disappearance of our compound and the appearance of compound plus GSH, and use that data to generate a GSH half-life. Ultimately, if we have a very short GSH half-life, this suggests that compound is intrinsically very reactive and is therefore likely to go in and interact with every cysteine that it can come across within as soon as you put it into a biological environment. Whereas something that has a longer GSH half-life, because we already know we've got binding because we've seen it as a hit, that suggests that the actual binding is more driven by the affinity of it for the binding pocket rather than the intrinsic reactivity of the warhead. And that's a good thing. That's what we want. That gives you selectivity for your target protein and reduces off-site toxicity. So we normally use this to triage out from those initial hits overly reactive warheads. I've mentioned reversible inhibitors being a bit of a pain. So you'll see here a typical plot. The top plot is your standard irreversible covalent inhibitor incubated with GSH. So you see disappearance of compounds, appearance of compound and GSH, and that reaction does reach completion if you leave it long enough. Whereas the second graph down shows you a typical plot for a reversible GSH assay. And you can see here, you get that initial bit of mopping up from the GSH of your compound, but then the equilibrium sets in and you get this plateau effect, and it's impossible to generate a half-life. So we developed an assay to counteract this, to get around this. So what we do is we'll allow that equilibrium to be reached. We will then introduce a positive control irreversible binder that will go in and effectively kick off your compound from the GSH and then release the compound back into solution. And we can monitor the reappearance of free drug and use that as an inverse measure of GSH reactivity. We're also able to look at binding rate kinetics by mass spectrometry. Apologies. So here we run a K-OBS assay, or we're looking at the observed rate of covalent bond formation. So this is just simply a time course. We're looking at percentage binding over time to see how it increases. We plot this data and can generate a K-OBS value. This is the assay we use as our primary assay on our covalent screening projects, or at least have in the past. And it's a very useful assay. It's quick, it's accurate, it's reproducible. So you take compound A, your scaffold, you make a modification to it. Does it increase or decrease your K-OBS? And you can then use that to drive your future compound design decisions and gives you information on your structure-activity relationship. So whilst KOBS is a very useful primary assay, what it doesn't tell you is whether your overall binding efficiency is being caused, or your improvement in binding efficiency is being caused by the affinity of your compound for the binding pocket or the intrinsic reactivity of the warhead. It's not implausible that introducing a particular functional group to your compound could alter the electronic environment around your warhead and make it fundamentally more or less reactive. So it's an important thing to be able to pull apart and determine what's increasing your overall efficiency. So we run the KNAT-KI assay to tell us this information. It's effectively the same workflow, the same setup as a KOBS assay. We're doing a time course study and monitoring the rate of, or the percentage of binding over time. The main difference being here is we run multiple different concentrations of compound, which gives us multiple plots looking similar to this. We would then process the data and the values from these analyses and put them into some mathematical equations. And this gives us a KNAT-KI plot and KNAT-KI value, which we use. That gives us the information we need about if it's binding affinity driven or intrinsic reactivity driven. This isn't as high a throughput assay, and it's not something we would run on every single compound that our chemists make, but it's quite useful for times, say, you make a new modification and you get a big jump in potency or covalent bond formation efficiency. And it's useful in that case to say, right, am I driving that increase by affinity or reactivity? And then hopefully it's the binding affinity that we've improved. But yeah, that gives you a useful metric to see if you're going in the right direction. If you are just altering your intrinsic reactivity, then you know that you probably want to leave that part of the molecule alone and explore elsewhere to improve binding affinity. And then finally, just to touch on our friend, the reversible binders again. So looking at the binding kinetics of these, they are trickier because you see in that plot in the top right corner, you do get that initial binding to protein, you observe that, but then you see this plateau off. So no matter how long you leave it, it never reaches completion. So we can generate a value of a KOBS value from that initial non-linear part of the curve, and we can report at what level the plateau we see, but technically that's not a true KOBS value because we're not allowing conditions that reach completion. So we came up with an assay, a way of actually assessing that, and we do this by removing the unbound fraction of the compound from the sample. So we will centrifuge a sample through molecular weight filters. This removes the unbound compound from the sample, and then because you've disrupted the equilibrium of that system, the compound will slowly, or potentially slowly, will let go of that protein to restore that equilibrium, and we can monitor the reappearance of that unbound compound and use that as an inverse metric of your KOBS, so a dissociation constant or a K-off value, which we can then use to compare compounds within a series to see if we've made improvements or not. So that's all I've got. That's all I've got to go through. Just to summarise, a quick intro to covalent inhibitors and their mechanisms. I've touched on how we perform our mass spectrometry-based covalent screening here at Domainex, how we can use peptide mapping to identify binding sites, as well as how we assess both intrinsic reactivity and binding kinetics for reversibles and irreversible compounds. I would just add that Gary has a poster over there around our whole covalent screening platform, so please feel free to come and talk to him about it. He's more than happy to have an in-depth discussion around mathematics as well, if that's of interest to you. So thank you for your attention.